starting recording to use this webinar with very valuable answers from Anthony after. So thank you for joining. It's already tradition when we have free webinars. Many people subscribed, but not many appeared. Anyway, thank you for efforts to those who with us today. And we are starting our webinar about new app, NHS Refugee Recruitment App, with nickname Ryalto. And I would like to represent our speaker today, Anthony Sembataya. He tells more about himself in a while, but so far we are lucky to have him to answer questions why we need this app and how this app can help you to find work in NHS. This app is for people with medical background and also for other Ukrainians who doesn't have a medical background. So thank you so much, our executive assistant, Zhenya Golovchenko, for organizing all these links and set up the Eventbrite event. And I'm Oksana Levachkina, CEO of the Ukrainian Medical Charity and project lead of the Ukrainian Medical Association of the UK. And we here in the UK support Ukrainian healthcare professionals and Ukrainians with links with UK healthcare sector. So far, I would like to announce that we have next summit with Mayor of London, where we discuss also how to help to support UK healthcare sector with refugees from Ukraine with their qualification. We will update all this information in our social media. So far, I would like to give a floor to Anthony. Anthony, can you please tell some words about you, and let's start the webinar.
Okay, thank you very much. And for the assistant director who has been organizing these things in the background. My name is Anthony Sembataya, and I work for Northwest London ICB. The Northwest London ICB is that part of London. The ICB takes charge of the NHS in the northwest part of London. So we work with about 8 NHS trusts, as well as GP practices, as well as anything, community trusts that are in the northwest London area. So I'm going to tell you about the program as a whole, and I'll also tell you about how to download and use the refugee app. Oksana prefers to call it Ryalto. If that is good for you, I have no problem. The first thing I'm going to tell you is I have put the links to download this app in the chat. So if you go to the chat now, if you've got a Samsung or iPhone, I've put the links there. You can go in and download it right now, so that as I tell you more about the app, if you have downloaded it, you'll be able to ask more questions while you're inside there. I'll also be practically taking you through the steps of downloading it very shortly. So let me tell you about the program right now, and then we can continue. I'm going to share some slides. Yeah, I hope everybody can see that. Yeah. So the program or the app is called the NHS Refugee Employment Support App. The program itself is called the Refugee Employment Program. So I usually work with my colleague Kira. She's unable to attend, but she works for NHS employers. So NHS employers, as you will see on this first slide here, is one part of the NHS that deals a lot with the employment issues around the NHS. I have to tell you that the NHS as a whole employs about 1.5 million people in the UK. So we are the largest employer in the UK, and we're also the largest employer in Europe, and probably the 6th or 5th largest employer in the world. The reason why we are telling you about this app and we are encouraging you to join us in the NHS is partly because of that reason, that we are a very, very big employer, and one way or another, there will be room for you to get a job in the NHS. So you take that as a reason. So we are bigger than, for example, the civil service. This is big. The other thing you need to understand also is that the NHS employs people who have studied medicine, who have studied nursing, but also it employs healthcare assistants. It employs people who are into IT, information technology, people who are in finance, people who just want to do administrative jobs, people into procurement, receptionists, cleaners, physiotherapists. It employs everybody, even mechanics, people in estates, people who support the buildings to keep them, tidy, and electricians. They are all employed in the NHS. Drivers. That is how we are able to run this huge organization. So by encouraging you to download this app and get a job in the NHS, don't think you have to be a medical person or a nurse. You can be anybody. Right, so NHS Employer does quite a lot of work, and it is highlighted on these slides here. Some of it is around the work we're doing, recruiting from abroad, and ensuring that trusts in their practice of employment can follow the right regulations and are supported very well, and that people who are employed by the NHS have got access to quality education and training. One, to improve their skills, but also to enable them to maximize the use of their careers, and also to be retained in the trusts that they work with. So this bit we are dealing with is a workforce supply issue, which is really about recruitment. Now, we've done some research, and research is showing that there are over 20,000 refugees in the UK who have got a right to work and who are able to work. There are also about 2,000 doctors who have graduated from overseas but are not being used properly in the UK, as in they are not working as doctors. And this piece of work is really to encourage, to find a way to get those people to work with the NHS where possible, but also the others that I've mentioned who are not doctors and dentists. So what we're trying to do by doing this is to make sure that we can maximize your chances of getting a job in the UK, in the NHS. We can help you with pastoral care. That if you've got a job in the NHS, we'll help you to be retained. If you have any questions, there's a program here to help you. But also we can engage with organizations like Oksana's Ukrainian Medical Charity that really link directly with people like you, so that we can work together to get you included in our recruitment pool, but also support you to get the actual recruitment. And we are talking about practical things, some of which I'll show you, like, the application form, the interview skills, the, understanding what the expectations are in the NHS. So what are the benefits of this program that we are doing? There are several benefits to the patients. If there is a good workforce, the patient is well looked after. If we are struggling as the NHS to fill vacancies, and this is pointing to workforce shortages, that means we are unable to look after those those patients, and also that the staff that are already employed in the trusts will struggle because they will be doing more work than they should be doing. And of course, we'll be risking patient safety. So in terms of the monetary side of things, if you are employed and contracted on a fixed term or permanent contract with the NHS, it means the NHS doesn't have to go out and hire temporary staffing people through agency who are very, very expensive. And it also means that instead of recruiting from abroad, we can recruit internally. So all these things matter. But for you as a person who is a refugee, if you get a job with the NHS or with any other organization, it helps your integration process because you get to meet new people, you get paid a salary, you can support your own family with better education opportunities, better housing opportunities, and also you're not socially excluded. Some people, you could be supported by a family and you're housed by family, but some people don't have that opportunity. They don't get to meet a lot of people outside of the people they talk to on the phone. So this is really, really important that we get inclusive in whichever areas. But also when you leave this thing of going to, for example, the job center to get universal credit every week or every month, the government will benefit from that, but you also benefit from it because you will be independent. So this is the app. So the app was done as a joint venture between the company called Ryalto, which we paid to do the app, and the actual owner of the app, which is NHS Employers, which is a big part of the NHS that deals with workforce issues. So the app itself looks like this once you download it. And I'll take you through the process of how to download this. And these are my names here, Anthony Sembati at nhs.net. If you ever need to contact me, this is the email. But I also work with my colleague, Kira. She works with NHS Employers. If you ever want to get in touch, please do. So we are going to go to the next step. This was just taking you through the program. And I need to tell you that this program has been running for the last 2.5 years. So it's not new, and that we have already employed refugees. Now, this week we hit 130 refugees have got employment opportunities in the NHS. There are about 76 people that have also got volunteering opportunities. So you're not going to be seeing a new thing, completely new in terms of you'll be the first one to be recruited, but you'll be the first ones to use the app. We believe that the app will help us to do this job better and much faster. I'm going to stop sharing this and then go to a different slide. You're going to ask your question. You'll have an opportunity to ask questions after this. So quickly, I'm going to take you through how the app works. So again, this is the app. To get to the app, you need to download it, or using the link that I've put in the chat, or you can scan any of these two. I'm going to leave them for a few seconds. You can use your phone right now and download the app. If you've got a Samsung or any other phone, scan this QR code. If you've got an Apple phone, use this one. Okay, gonna move on. We will come back to it at some point. So what does the app do? We've started with using this app in London, and what it will do is it will give you direct access to the jobs in the NHS directly on your phone. It will also give you access to the support that is available with the charities and other organizations that we work with. These are organizations that will help you if for example, you need help to do an application form, or if you need some training in English, if you need to practice for an interview, if, for example, you've suffered some sort of trauma in your journey to get to the UK and you can't adjust quickly, any mental health support that you need, there will be organizations on the app that will help you. So there are links that are listed on the app. You just click on it and it will show you. Also, the app has got a tab which gives you news. The news that is on the app is really about immigration and working conditions for refugees. So a lot of the information that comes from the Parliament, from the Home Office, and from any other charities about immigration, we collect it and upload it there so that you can just look at it from one screen. So please use the news section as much as you want. It has also got a chat function where you can chat to us directly, ask questions. That function is also on there. Again, this is the QR codes that you can scan now to access the okay. So now let me take you straight to the slide that shows how to access the app. Sorry, let me first open it for you. How to access the app. Okay. All right. So when you download the app, this is what you will see. Ryalto is the company that has helped develop the app. The app is owned by NHS employers, as you will see. So the first thing you do here is click on sign up, this blue one here. When you click on sign up, it will bring up a page. When you're downloading, this is what you will see. Yeah, and then you click on sign up, and then it will take you to this page, which I'm going to go into more details. So put in your name, put in your first name, last name, email address, confirm your email address. Now, this is the part that confuses people a lot. It asks for organization. When you see the word organization, you click on it. It will bring a drop-down list. Select the one that says NHS Refugee App. So I'm going to show it to you here. So it looks like this Refugee App. When you reach the point of organization, select Refugee App. Don't select NHSP. Select Refugee App, and then it will start asking you, do you have refugee status? Just answer yes, and any other questions it asks you, depending on what you want to respond to, you say yes. So the next question would be, what type of role are you interested in? So briefly, we have categorized the roles into 5 categories. Entry-level roles, allied health professionals, nurses, doctors, and dentists. So anybody who is not a nurse or a doctor, anybody who does management, IT, administrative, cleaning, anything, should click on the first one. It will be much faster there. Because when you click on it, you can go inside, as I will show you, and delete the word, for example, healthcare assistant, and put in the name of the job title you are interested in. Say, for example, you want to be an IT help desk person or support. That's what you put in. But for now, you put entry level or HCA or domestic. Just click on that, and then you can proceed. The next question it will ask you will be, are you qualified? So if you're a doctor who has qualified from Ukraine, or a nurse who qualified from Ukraine, or a physiotherapist who qualified from Ukraine, obviously you put yes. If you are a manager or a procurement person, a finance person, IT, or an administrator that qualified from Ukraine, you can again put yes, okay? And then the last question it will ask you is, what is your location? The location you're in most likely will be London. So, although you're seeing a lot of this, but we've just tried to break them down for you to make it as easy as possible. But the reality is, this is the list of questions you're being asked, this one here. We've broken them down into this so that you can be able we can take you through them question by question. So after you've selected your location, which is London, or if you're in another region, you can put other. So I cannot guarantee that everyone here will be from London. The next thing you do is you put in your password, select a password that you remember, and tick that button, that box at the bottom, to agree with the terms and conditions. So put in your password, it will ask you for the password again, just to confirm it, and then tick that box and sign up. That is all you have to do. Once you've done that, this is what will happen. So it will send you an email to your email address automatically, and you go into your email address and there will be an email from Ryalto, and it will ask you to verify whether this is your email address, the email you used when signing up. So you click on that part which says verify, and once you do that, it will say your email has been successfully confirmed, which then means the next thing is to log into the app. So at this point, you'll have had the app on your phone, like any other app, you'll see it. It's called Ryalto. So click on login, don't click on sign up again, just click on login, put in your email address like that, and the password you have used, and login, and then you've got the app on you. So that is how it works. You download by signing up. Once you've signed up, you verify from your email. Once you've done that, you log in by putting in the exact email you have used and the password you have used, and you'll come to the app. Now, inside the app, this is what you're going to see again, the kinds of jobs that I mentioned here. They are here. This list of jobs will come up. Entry-level AHP, they will all come up here in the app. So if you're inside the app and you want to find an actual job, you click on, let's say, any of these buttons, and it will bring up the NHS the NHS jobs website, and then those jobs will have been selected by whatever you selected here. So if your type of job that you want is not in there, all you have to do is go into that job title part, delete that job title, and put in the job title you're interested in. So if you want to be a security officer, or if you want to be a mechanic or an engineer, you write the word engineer in and click search. And all the jobs will come in. You scroll down and then you'll be able to apply. I'm going to play you a video quickly of this as well. Then we will ask some questions. Stop sharing. Okay, it's a YouTube video, so let's see how it works. It's a quick video, so I'm just going to play it again. Thank you. So on this video, you see some of the functions directly. So you can see some of the functions directly here. This is once you've signed in, and this is the number, the amount of selections of things that you can do with the app. If you need to contact us, and you've got any questions, click on this bit, the help and support button, and it will automatically generate your email. Just write in the box whatever question you want to ask and send. It will come to us and we will endeavor to reply as quickly as possible. If you're interested in the news section, that is what it looks like, just below doctors and dentists. If you're a doctor and you've qualified from Ukraine, please register as a doctor so that we can know how many doctors we've got in the UK and where do they live. So that if there is any help, any training, any opportunities that we can offer you, we can contact you directly. But also, if you've got your GMC registration, General Medical Council registration already, you can then access the jobs directly. But if there is another way we can help you, we'll do that as well. There's also a list of frequently asked questions. You can also click on those ones and find them. For each job that you access, there is a list. When you click on the job, for example, allied health professionals, there's a list of links of organizations that can help you. So you have to first click inside and the links will come. For example, this is an example of one of the links, the Lincolnshire Refugee Doctor Project. But also there is one here, upcoming events on the for Ukrainian health professionals. So that really means that Oksana has already given us a link to her website, and whatever Oksana is planning to do, you can access that information straight through the app, as well as information from the Nursing and Midwifery Council, from the General Medical Council. All those things are supplied on there. Let me see if I can show you something else using the video. Yeah, that's what the app looks like inside. Okay, the app has got something else. When we've got events, we can create a calendar of events in there. Hopefully you will be able to see them as well. What else am I missing? That's how you sign up to it. Let me see if I've missed something. I guess we should go to the questions now, because usually we have quite a number of questions. Yes. Can we take any questions? In the meantime, let me just remind you, please go into the chat room. You'll find the links on how to download the app, and then you can download the app using the stages that I've shown you, and you can ask any questions. Oksana, over to you
okay, we have Oksana on the call, sorry. We have a question from Anna Yezhova. Anna, could you please ask?
Okay, thank you very much. I'm actually here with my husband, who is Ukrainian. His English still needs improvement. So on behalf, I would like to just clarify several things to, maybe like to ascertain the definitions are correct. since we're here in the Ukrainian community, but you constantly refer to the refugees. What I mean to clarify the status, if we are on the Ukrainian scheme, which is not a refugee scheme, according to the government of the UK, well, it's still this app, we can still use it, right? On the Homes for Ukraine scheme.
Yes.
Okay, thank you. That's the first point. The second point, when you were detailing the application, the Ryalto, and you're saying that the doctors who have qualified in Ukraine, meaning they have a university degree from a Ukrainian university, have had their internship, have finished, and had many years of service, but in the UK, they have not completed the OET test or any other necessary steps, the PLAB, yet. Can they sign up as doctors in your app?
Yes.
Okay, so they're
let me
qualified
explain that.
internationally, but not in the UK yet. They can still go into the app and say that they're a doctor.
Let me explain why I did say that. So this app has been created specifically for refugees only. Now, before I explain that, let me go and answer the other question you mentioned about homes for Ukrainians. Yeah. So
yes, it's a scheme. It's a visa scheme, but it is not classified as a refugee according to the whatever qualification the UK government has, or at least of all the things that I've read.
Okay, so I will not dwell a lot into that, but every Ukrainian who is here in the UK and came after the war started, yeah, and sought refuge in the UK, that is why you qualified for the house. That is the process. You sought refuge and then you qualified for the house. That is why you're being supported. So you may not call yourself a refugee. The one thing you're not an asylum seeker. That is different.
Right. Okay.
But you are automatically a refugee because you sought refuge in the UK because of the war in Ukraine. So you automatically qualify for all these services that I'm talking about. Yeah. Now going back to the doctor question. So this app has been created specifically for refugees, not only from Ukraine, but from everywhere who are seeking, who want to work in the UK, but have been unable to find work or are doing jobs that they didn't want to do in the first place. That is the purpose. But the government, as well as us people in the NHS, we've been hearing of there are a lot of refugees in the UK who are highly qualified, but we don't know which skills they've got, I mean the qualifications they've got, and we don't know where they are. We know they are in the UK, but we don't know where exactly. Are they in Clapham? Are they in central London? Are they in Ealing? Where are they? So by creating this app and giving you access to the jobs directly, one, we want you to register as a doctor because you're a doctor. If you're qualified in Ukraine as a doctor, you're a doctor. It's just that you haven't got GMC registration and done any OAT. That does not mean you're not a doctor. So if there is help to enable you to get that PLAB finished, that GMC registration completed, and do any OET, whatever you need to do, that help will only come if we know that you're here and if we know where you are and if we've got your contact. That's why you need to register as a doctor if you are a doctor. If you left Ukraine and you were not a doctor, but you've aspired to be a doctor and you're not currently studying as a doctor in the UK, please don't register as a doctor, because some people think, I want to be a doctor in future. Let me register on the app as a doctor. You're not yet a doctor. That is different from someone who qualified already. Am I clear in that way?
Yes.
And also for the
clear.
nurses,
Thank you.
The nurses, the same thing. If you're a nurse from Ukraine, register as a nurse. That's the only way we will know there is a nurse who is looking for a job, and then we will help you in that way. Sometimes and we've had a few doctors from Ukraine who are working already. I've got some doctors at Imperial. They didn't have GMC registration. Yeah. So they don't go and work as doctors. They go and work as senior healthcare assistants. So when you're working in a hospital and we know that you're a doctor, other doctors and other professionals will respect you because they know that you're a doctor. But if you need help to get the PLAB or to get the GMC registration and all those exams, there will be a community of doctors because you will be working in a hospital environment. So it will be much easier. And so for the nurses, there are specific things they do for you to requalify, which we will be happy to share. And I think which Oksana shares quite a lot. Have I answered that question?
Yes, that was very good. Thank you, a full answer. And then the final clarification as to location. You're speaking mainly of London. So we are currently based in Canterbury, which is not that far from London, but I mean, we can still register, right? Even though location is not London directly. Because if there are opportunities in London, we'll definitely consider moving.
I've got some contacts in Kent that would be looking to support refugees. So you can send me an email. I think the hospital is Midway something hospital. I've been talking to them. So other regions are also going to take on this project and recruit refugees from their local areas. And that is the reason why there are regions, London. So next we'll be doing Manchester, and then South of England or Southeast. That's where Kent is, Wales, Scotland. We just wanted to identify where you are so that if we are trying to help you, if you're in Kent, instead of telling someone from Manchester to help you, we can tell you that there's someone in Midway Hospital that can help you. That way you don't have to travel long distance and you can stay in the area where you are and work in that area. That is the purpose of that. But if you're not in London right now, the bit that says other, tick that box and put other. But I need to know that people are downloading the app as we speak, because that is the purpose of this webinar, so that you can download the app as we go on this webinar, and then you can ask questions. And if you're having any difficulties, I'll be able to answer the questions while we are online right now.
Okay,
Natalia?
thank you very much.
Is it Natalia? Have I pronounced it well?
Okay.
Yeah.
Thank you, Anthony.
Right.
Yes, we are waiting for questions from Natalia.
Yeah, thank you. First of all, Anthony, thank you very much for your speech and for this app. I think it's really good for us. So I'm a registered doctor in the UK. Luckily, I received my full GMC registration in November last year. I done 2 clinical attachments, but still, unfortunately, I can't get a permanent job due to, like what lots of hospitals and trusts say, due to lack of paid NHS experience. What is understandable, yeah. I have worked as a clinical care coordinator in PCN and phlebotomist and healthcare assistant, but even all of these connections still, unfortunately, can't lead me to find a job as a doctor in NHS.
Yeah.
GP told me that I have 12 months till I need to find a job, or they take my license, kind of practice license to practice. Then I need to stop this, or I need to find a design body, whatever. My question is, why this app can like trust or hospitals help me with this, maybe finding another clinical attachment or just some way to help me to get through this obstacle, because at the moment I done everything and I still can't get a job. Thank you.
That's a good question, and I empathize with you. It is true, people get GMC registration, they do all the PLABs, and sometimes they struggle to get jobs. And that is the purpose of this app, because we have had this situation where people are talking about refugees who are doctors, but nobody knows who they are and where they are. So we are talking directly to the government as well as to NHS England, which leads the whole of the NHS and the Department of Health, so that when we have people like you, Natalia, we can say, okay, here is Natalia, and we are talking to the directors of human resources of each of the trusts. Where are you located?
So I'm near Leicester.
Sorry, near Leicester.
Yeah, but I'm quite mobile. I can relocate anywhere, to be honest.
Okay, so
not in Ireland even. I mean, I don't care. It's just to get through this first job in NHS. I'm really free to relocate.
Okay, so you send me an email, yeah, because you're a good case study, yeah. I'm not going to use you as a case study, but what I'm trying to say is, if we had another webinar like this in a month's time or 3 months' time, it would be good for you to come back and tell these people whether we did anything or nothing has ever happened. So,
Okay.
so we are going to use you as the case study for this webinar.
You can use.
See.
And you can use whatever you need to use.
Yeah. So you send me an email, yeah, with your CV properly, you know, like you would do, yeah, and you tell me your area of specification if you're a specialist in any area, and then I'll see what I can do to help you.
Thank you.
And get some links forward for you, because we have to make this thing work. Otherwise, we are wasting people's time. But the purpose is to know how many doctors we've got. Are they working or not? Where are they located? So that if we are speaking to the hospital in the NHS Trust in Leicester, we can say, we've got Natalia, who is 5 miles or 1 kilometer away from the hospital, and up to now, they are not working as a doctor, but they've got GMC registration. Why? And then that HR director or medical director will be able to answer to everybody why they are not giving you a job. So let's focus on that.
Thank you.
Yeah?
I will send you emails. Thank you.
So please register with the app and encourage your friends who are in your sort of category, because we also need to know how many have got GMC registration and how many have not. Yeah?
Thank you.
Okay. All right. Any other questions? Maybe I'm not seeing properly. Go to page 2.
Please. Do somebody have some questions for Anthony?
So while people are thinking of their questions, let me put up this thing again, because I need yeah. So we need to know how many people on this app have managed to download this app today, and if there are any things that they're facing, any problems they're facing, we can help them. So by a show of hands, could you just let us know whether you've downloaded the app?
Колеги, можете підняти руки, хто завантажив додаток? Okay. As we see.
For the people who haven't downloaded it, is there anything we can do to help you to download it? This is the QR code that you need. And if you just need to not to download it via the QR code, you can use the link in the chat. Oksana, could you tell them in Ukrainian so that people might understand exactly what we are talking about?
Так, друзі, будь ласка, завантажте додаток, ви можете це зробити через чат, є посилання. Якщо хтось не бачить, я можу повторити, будь ласка, напишіть. Або зіскануйте код і також завантажте, тому що це дуже важливо наразі. І якщо у когось є питання, будь ласка, чекаємо на ваші питання. У нас ще з вами близько 10 хвилин.
Okay. So when we finish, you can always go back to the chat and, oh, I've got some people. Are these hands for questions, or is it because they wanted to show that they had?
Sorry, I can say that it does not work. It's blurred. See, when I try to reach the entry level from my phone, it doesn't work. It just work through the web page, but through the app it does not work for now. So I can do nothing and see nothing.
Sorry, we can't see your screen. That's the problem.
I can see.
Okay, yeah. So you've got the app.
Trying. Yeah, I'm trying to go entry level. See.
Okay, wait.
That's
there.
it.
Just wait.
Yeah, I waited for a few minutes, but it doesn't work.
It might be your internet.
No, isn't right? It's okay because through the site, it works. See?
Okay.
Through the web page, but sorry.
So yeah, we can see that. So if you go to, do you see that woman, the picture of the woman on that page? Yeah. Click on that.
Yeah.
And show me again. Click on.
You mean this vacancy?
Yeah.
Yeah. I can open. I can open it through the website, but not through the application. So it's now the Safari web browser.
So that is the app. You're inside the app.
Okay, but it's in browser, but not on the application.
Okay. Are you? I don't know how to answer that. So when you downloaded the app and then you got inside, that is the only way you would have seen those pictures. So the browser is probably the app. What you're calling the browser is also the app. There is no way you could see those pictures without. So if you put the screen back again and I show you.
Yeah, I understand what you mean. I just wanted to let you know that application does not work through the through the application in my case, but it works only when I go to Safari.
Okay. Oh,
yeah,
okay. No, fair enough. Okay, probably that is a technical thing that requires Safari, but I've got it on my phone and it works. I don't know whether something is blocking it on yours. But either way, you click on that picture, you'll see a blue line, yeah, which says jobs. If you click on it, you'll see the entire list of jobs that we are looking at. Then you can be able to apply. Also, if you've got any questions, go to the whatever, and you can always ask some questions. We'll be happy to help. I think we've got another hand. Sorry, were you asking something else?
Yes, I would like to ask for next question, if it's okay. Vlad, do you have some questions? I think Vlad doesn't have question. Sergey?
Hi. Yeah, I'm very sorry. I've just missed the beginning, so my question is maybe relevant to this. But the question is this app for doctor vacancies only, for refugee doctors vacancies only, or for other vacancies within the NHS system, because I had a talk with an NHS HR several months ago, and she told me there are 350 types of vacancies besides doctors and nurses, and those types of accesses range from air traffic controllers to builders to property managers to everyone. So the question is the app for doctors only or nurses only, or are there any other types of vacancies there?
So the answer is no. It is not for doctors only. It is for everybody. Yeah. So once you download the app, and if you've missed the first part, go to the chat room. At the top of the chat room, I don't know that it will show you, there is a link for you to download the app. If you've got an iPhone, there is a separate link, which is the second one. The first link is for people who have got Samsung and other phones. So there is a process to download, which I've taken everybody through. Just for you, when you're downloading, just click sign up, and when you reach an area where it asks for organization, click on Refugee App. Those are the most complicated bits of the downloading process. Right. Sign up, and then so once you download, it will go to Ryalto, which is the company that is developing the app for the NHS. But then you download the app and then click on sign up. When you put in your name's email address, if it asks you for the organization, there are two options, one NHSP and another one called Refugee App. Select Refugee App. The rest is easy. Yeah, the rest is easy. You will be able to, I think was it Azia that just showed us the screen? You'll be able to see what happens inside the app while you're inside, and you can use it for news. You can use it to see any training that is available. You can use it for information on what charities like the Ukrainian Medical Charity can offer. If you're looking for a job, it can help you by signposting you to organizations that can help you with the application form, with interviews. There are also organizations, when you're ready to get a job, and on the day you don't have a suit, let's say you wanted to put on a suit for your interview, and you looked in your wardrobe and there is no suitable suit. There are organizations that can give you clothing for your interview. So we're trying to put in as much as possible so that you're ready for a job. If you've got any questions, there is a question and support button on the app. You can always ask a question and we will be able to help you.
Fantastic, amazing. Thank you for your quite extensive answer. And just a quick question after this first one. I currently work at a charity organization. We help refugees here in Scotland, in Aberdeenshire. Can we somehow be partners for, we might have a job or a volunteering position for a Ukrainian refugee. A Ukrainian refugee, myself, we provide support to people with anxiety and PTSD symptoms, and we use horses to provide that help. So maybe we could partner with you.
Yeah.
In terms of searching for people who would like to join us.
No problem. So what you have to do is you have to send me an email. My contact is in when you go into the app itself and you look on the support or question bit, if you send an email, it will come to me. I'll be one of the people to access it, or you can ask Oksana to give you my email address. We've got, I think, some partners that are working with us in Scotland on this very program. So we'll be happy to help you. For us, our aim is to get people jobs, refugees specifically, jobs. If you can offer some volunteering opportunities, because some people need a bit of confidence before they go into the work environment, that can be very helpful. If you can offer a job that they can do in a charity, as long as someone is happy, we are happy. Yeah, although we are the NHS, but we don't stop other areas from getting.
Thank you so much.
Yeah.
Thank you very much.
Right. I think we've got 4 minutes. Any other questions? Or let me put up this link again, and I keep putting it up because I need you people to sign up so that you know. So for Sehi and anyone who came late, if you want to scan this QR code, that is the QR code you use to access the app. Anybody who hasn't signed up, this is your good chance to do the link, and then we'll be gone. Right? Okay. So, unless there are any other questions, I will hand over back to you. Yeah.
I think we don't have any questions. Anthony, thank you for very useful information. It was amazing, and it seems that this app will have a big success, and all our nurses, doctors, and medical professionals also. Everyone, if you have questions, you can send these questions now through registration for webinar form or to Ukrainian Medical Charity, and we will refer these questions to Anthony, or Anthony shared with you his contacts.
Oh, this is my contact. Let me just put it here. So I've put it in the chat. Anyone who has any questions, they can contact me directly. Right? Okay. Nice talking to you people, and have a good rest of the week. And thank you for coming. Please share this information as much as possible. Bye.
Bye. Thank you very much.
All right. Cheers. Bye.
Bye-bye. Thank you.
Bye.